Hi there, you're here for sleep apnea, in particular obstructive sleep apnea. Well, I'm Dr. David Jin. I'm here to take you on this journey to learn about sleep apnea and what can we do to help you along the way with your sleep apnea. First of all, you got to understand the danger of snoring and untreated sleep apnea. Great majority of you come to me because you or somebody is telling you that you're snoring. Well, I'm going to tell you the fact that you're snoring, very likely there's underlying cause of sleep apnea. Well, let's dive into that. This is Dr. Doblin, and that's me. You guys can read about us online. OSA, O stands for obstruction. Okay, so we're going to talk about what is sleep apnea, what does it do to your body, and how is it being treated, and what can we do as a dentist to help you. Something to think about. You can live 3 weeks without food, 3 days without water, and probably only about 3 minutes without air. During normal breathing, well, your muscle relaxes, your airway stays open, air passes through all the soft tissues, everything in the back of your throat, such as your soft palate, uvula, your tonsils, your adenoids, and your tongue. Well, when that becomes a little bit obstructed, well, what happens is as you fall asleep, your muscle relaxes, this tongue, which is a 5-pound bowling ball, start rolling back to the back of your throat, collapse on the uvula, hence collapse your airway and stop you from breathing. Well, prior to that, that's when you're snoring. Snoring is what happens when the airway gets narrower and narrower, air passes through at a much higher speed, which creates turbulence. Turbulence is what snoring sound is all about. 40 to 60% of the adults snores, and 70% of those loud snorers have some version of sleep apnea. Here's an animation of what happens when we snore. Well, normal breathing, air passes through freely. Well, as we fall deeper asleep, you're going to see the tongue and the uvula start falling back, and now and as air pushes through, it creates vibration on the soft tissue, which again creates turbulence, and hence you're snoring. Well, this is the sleep cycle, right? We fall asleep, somewhere along the line, sleep apnea kicks in. Your airway collapses, apnea happens, that means you're not breathing, hypoxia kicks in also because you're low oxygen, right? And while your body is still functioning, so you're creating more and more carbon dioxide, it becomes hypercapnia. Hypercapnia increases your ventilation effort, which is wake you up, and now your airway pops open. Since your airway is open, you're going to take a couple quick breaths called hyperventilation, and then you try to fall asleep again. That is one cycle of something what we call AHI, apnea hypopnea index, which means how often do you stop breathing within a period of an hour on the average. Well, just imagine if you stop breathing for 60 to 90 seconds up to 500 times per night. Remember, in an 8-hour sleep night, there's only 480 minutes. That means you're stopping to breathe every minute of the night. Just imagine somebody suffocating you or strangling you, 60 to 90 seconds each time for 500 times per night. How do you think you're going to look in the morning? In the morning. Well, that's what happens. Most people with sleep apnea are 4 times likely to have heart attack. 40% higher chance of depression, 40% higher chance of high blood pressure, 90% of stroke victims have some version of OSA, twice as likely to die in your sleep, and more likely to become diabetic. Well, if you're not breathing properly, what hospital usually do is put you on a ventilator. And that's what CPAP is. CPAP is basically a machine that forces air through your nose into your lungs. Question is this how you like to sleep for the rest of your life? Or would you like to wake up to somebody, your bed partner, sleeping like that next to you? Well, our solution is rather simple. As you snore, what happens is you got a lot of vibration, soft tissues in the back of your throat, collapsing your airway. And what we do is basically CPR. Okay, CPR means there's a head tilt and chin lift. Well, our appliance basically what it does is lift up your chin for you, So as you increase airspace behind the back of your throat, that means you stop snoring, and hence you reduce your chance of sleep apnea. Sleep apnea will cause, of course, snoring, fatigue, daytime sleepiness, intellectual decline, obesity, diabetes, respiratory disorder, sleeping problems, high blood pressure, heart disease, sexual dysfunctions. Most people say, why? Well, think about it. Focus on oxygen. You are depriving yourself oxygen, and all these are problems caused by lack of oxygen. Symptoms are very simple. Excessive daytime sleepiness, falling asleep all over the place, depression, headache, migraines, acid reflux, tired driving, sexual dysfunction, hormone irregularities, decreased energy and motivation, weight gain, marital discord, decreased job performance. Keep in mind, number one cause of a car accident is tired driving, according to AAA back in 1999. Heart attack risk factor increases. Look at this. The 23.33, whereas smoking is only 11.1. That's twice as much as smoking. And this is according to the NIH. As you deprive yourself of sleep, two things happen to your body. One is called leptin, the other one is called ghrelin. Ghrelin, sometimes I call it gremlin, and you'll understand why later. Leptin is a neurotransmitter produced by your fat cell that regulates your appetite. The lower the leptin increases your appetite. On the other hand, gremlin is a hormone produced by our cell linings of the stomach, and it stimulates hunger. Well, you got one booger is telling you that you're hungry, the other one tell you could eat a lot more, so hence your weight gain. Well, this is the reason why you're here. Secondhand snoring. Well, somebody is complaining about your snoring, and that particular person, whether your spouse, your bed partners, he or she is sleeping 62 minutes less than you because of your snoring. Currently, the most common way of treating snoring or sleep apnea is CPAP. CPAP treatment, the reason it's common is because it's been around for a while. Well, problem with that is, look at this. How would you like to have this whole entire mask and everything on your head and when you go to sleep? You look like a Darth Vader, right? My common issue with it is I can't sleep, I can't move, become claustrophobic. The luggage, well, you got big machine and tubings, and then the water jug, everything. And then, of course, it makes a loud machine noise. OAT, our treatment is rather simple. Just an appliance, very small appliance that's easy to carry, even to carry in your purse. Basically, our appliance is 100% FDA approved. We do have a 90% success rate in significant reduction of your snoring. And we also have 100% success in improve your AHI, the apnea hypopnea index that I was talking about. How do we know? Because we test everybody in the beginning, and then we retest everybody to make sure that our appliance are efficacy. Well, OAT versus CPAP, right? Basically, you're looking at, you don't have to wear anything when you sleep. The other one, you look like a Darth Vader. Traveling, small compact box, this, a big giant suitcase. Weight loss, I can't stress less. The more mass you reduce on the outside, it's very, very likely a portion of it you're going to lose on the inside. Just keep that in mind. Basically, we are around two. The more we gain on the outside, on the flip side, the narrower our airway. Well, this is it. Now that you understand the danger of sleep apnea and how we can help you and how convenient it is to wear our appliance, well, it's important for you guys to spread the words. Keep in mind, only 2 out or 3 out of every 1,000 people who have sleep apnea has been successfully treated. Why? Because we don't think of it as a disease. We don't think of it as a problem. And what I like to do is tell the public that it is a problem. Lack of sleep is an issue. Let's spread the words.